Tonight, Jamaica recorded its highest total of COVID-19 cases within a 24-hour period yesterday, with 263 new cases and 2 additional deaths. Minister of Health reassures Jamaicans that taking the vaccine will be voluntary and will come at no cost.
It is a choice, even though we are encouraging it. There's no law that says you have to take it. You will get the vaccine at the cost of the government and by extension, I guess, the taxpayers.
Still tonight, Kingston Western Police list 22 persons of interest amidst gang conflict. And during the PSOJ's press conference held yesterday, President Keith Duncan pointed out the importance of unity in fighting the crime epidemic currently facing the country.
We have to tackle this epidemic united. If we don't, we are creating our own demise.
Good evening. Jamaica recorded 263 new cases of COVID-19 and 2 additional deaths yesterday. Now, this takes the total of confirmed cases to 16,513 and the death toll to 357. According to the Ministry of Health and Wellness, a 78-year-old male from St. Mary and a 71-year-old male from St. Catherine, who were both previously under investigation, are the country's latest fatalities. Now, of the 263 newly reported cases, there were 114 males and 149 females, ranging in age from 1 day to 87 years. The cases were recorded in Kingston and St. Andrew with 70 cases, St. Catherine recorded 64 cases, Manchester 46, Clarendon 32, St. Anne 20, St. Elizabeth recorded 12 cases, Trelawney recorded 7 cases, Westmoreland and St. James recorded 4 new cases each, while Hanover and Portland recorded 1 case each. The country recorded no new recoveries from the virus. As such, recoveries remain at 12,174, with 3,797 active cases. In the meantime, with 263 cases recorded from 1,785 samples tested within the last 24 hours, Jamaica has recorded its highest number of COVID-19 cases within a 24-hour period. The Ministry of Health and Wellness, in a statement earlier today, expressed that the increase in the daily positivity rate of 14.73% is a cause for concern and reflects that there might be a complacent attitude that is taking hold in the population regarding COVID-19 protocols. According to the ministry, more symptomatic persons are presenting at health facilities, adding that symptomatic persons are not taking precautions at home. As such, contact tracing is yielding several positives in households and communities. Many of these contacts are without symptoms and are not adhering to any infection prevention and control measures. The ministry further outlined that to stop transmission, all persons, symptomatic or not, or whether they believe they are exposed or not, must wear masks, wash hands, and hand sanitize frequently. Sick persons must stay at home, and all persons in the household must take precautions in the home. Portfolio Minister Dr. Christopher Tufton is reminding Jamaicans of the need to strictly observe the COVID-19 protocols that the government of Jamaica has put in place to protect them and others from contracting the virus. Still making news tonight, during a COVID-19 digital conversation held by the Ministry of Health and Wellness yesterday, Portfolio Minister Dr. Christopher Tufton reassured Jamaicans that taking the vaccine will be voluntary and will come at no cost to them.
The vaccine will be free to all Jamaicans who wish to take the vaccine. It is a choice, even though we are encouraging it. There's no law that says you have to take it. And so, yes, you will be free. You will get the vaccine at the cost of the government and by extension, I guess, the taxpayers. The issue now becomes when you are eligible by virtue of vulnerable groups and then the other groups that will come after, because we're giving priority to certain segments and then we move eventually to the full population.
Chief Medical Officer CMO in the Ministry of Health MOH, Dr. Jacqueline Bisaser McKenzie, explained recommendations for the vaccinations of those persons who are immunocompromised.
The big problem we have with vaccination of those persons is when we use live vaccines. So these vaccines are not live vaccines. So that is the first thing that the population needs to bear in mind. So they are safe in persons who are immunocompromised. Important thing is that immunocompromised persons and persons with chronic diseases are the persons that are more at risk for serious illnesses. So those are the persons that we do want to become vaccinated against COVID-19. But these vaccines are safe because it's not live virus that is entering your body that has any chance of getting out of control, as what people would think.
Dr. Bisaser McKenzie further reassured the public that the ministry will have the necessary measures in place in case issues arise from the COVID-19 vaccination.
Vaccine is going to be safe. And so therefore at all our sites that we are going to be vaccinating, we will have the necessary things in place in case there are any issues that will come up. And persons will respond differently to vaccines regardless of which vaccine it is, So we will have the necessary staff in place to deal with any problems. In terms of if persons develop problems after, we do have a program for evaluating events that occur after vaccination that we follow persons over a period of time to monitor any adverse events that occur. Now, as those are recorded and reported, then we will deal with those as indicated.
In news from the capital, the Kingston West Police have listed 22 individuals as persons of interest following an ongoing gang conflict within the Denham Town Police District, which has extended to several other communities in the division from the Scream Corner gang. Among the persons are Ricardo Dennis, Richard Ellis, otherwise called Boya, Shaquille Davis, otherwise called Tika, Shamorise Williams, otherwise called Godzilla, Roberto Moreland, otherwise called Pilot, O'Shane Stewart, otherwise called Nero Blacks, and Renardo Phipps, otherwise called Fry Eye. Meanwhile, individuals that form a part of the Tivoli Young Generation gang that are listed as persons of interest include Tajay Freeman, otherwise called Weng, Rashawn Samuels, otherwise called Son Son, and Dujon Caban, otherwise called Pepe, Andrew Lloyd Coke, otherwise called Raheem, Lester Coke, and Narado Kirkpatrick, otherwise called Cheese Tricks Man, and Nakeem Kirkpatrick, otherwise called OG. These persons were urged to turn themselves in to the Denham Town Police Station earlier today. We will bring you more on this story in subsequent newscasts. Still making the news tonight, during the Private Sector Organization of Jamaica's PSOJ's press conference yesterday, President Keith Duncan pointed out the importance of unity in fighting the crime epidemic facing the country.
Jamaica has been at crisis levels with murder rates of over 1,000 per year for the past 2 decades. Both political parties have been in power for almost equal time over this period. Both have made well-intentioned efforts and both have unrelentingly critiqued each other in the public domain while the murders continued unabated, while our security forces battled with inadequate tools to effectively contain this epidemic. Jamaica's social intervention efforts over the same period under both administrations have not delivered the results as they have been disjointed, not targeted, and not monitored and evaluated for effectiveness. In the meantime, the gang culture has been entrenched in marginalized and depressed communities where the education system and social intervention efforts have not delivered, and the youth became and continue to become easy prey for the gangs due to their hopelessness and not seeing a way out for themselves. We have to tackle this epidemic united. If we don't, we are creating our own demise.
The president of the PSAG further expressed that the effort in reducing and fighting crime will also require a bipartisan approach.
Jamaica has no more time for political one-upmanship. We have had and continue to have a major crisis in our society. I am sure that we all have the desire to sleep with our windows open, and in the case of the violence-prone communities, on our beds and not under our beds, while the gangs trade gunshots. I am sure that all of Jamaica would like to unite for change, to implement sustainable crime prevention and crime reduction solutions to effectively contain and dismantle these gangs as they spiral out of control and take innocent lives. I am quite sure that we all want to live good in Jamaica. However, this epidemic of crime will require an all of Jamaica approach, a bipartisan effort.
Also speaking at the press conference, Director of Operations at Guardsmen Limited, Lieutenant Commander George Overton, in commending police efforts in fighting crime, pointed out that more needs to be done with restorative justice.
The police are doing very good work, as you indicated. Within an hour and a half of that contract killing in St. Elizabeth, they had the perpetrators in custody. Similarly, in Trelawney, within hours, they had persons in custody connected to it. One of the things that has to be worked on is the whole restorative justice and the matter of dispute resolution. We need to get that build out into the communities, because both of those incidents arose and would fall into the category actually of domestic disputes, because the parties knew each other. The persons who did the contracting and organized knew the person that they were organizing to wipe out. And therefore dispute resolution in the communities has to be built out, and that is part of the whole social investment, along with the heart programs that you speak to. They have to be targeted. You know, in the past, we did the scattershot approach in the communities with the various programs. It has to now be very focused, very targeted. The spend must be measured, but more importantly, the impact and the outcomes have to give us the results. It can't be just spend, spend, spend. And therefore, when heart comes in, there has to be a purpose and a mission. When we come in and we establish within the police stations and the police and the communities, the wider communities, that whole matter of dispute resolution, we have to encourage our people to utilize it so that we don't fall back on this, that killing is the only way to solve the problem.
Meanwhile, Minister of National Security Dr. Horace Chang earlier today gave an update on the persons that were arrested in the case of the killing of 51-year-old Andrea Lowe Garwood.
Very traumatic, but I think they have arrested all the associates involved in the killing. The shutter has been picked up, and he came in. The gentleman who drove the car, the one who rented the car, and of course, the one who is the alleged organizer. But I'm not sure if the charges have been formally laid, and therefore I want to say that the investigation points in that direction, and they have detained all four. So I think the police should just complete its investigation to ensure that when they go to court, their case is settled.
And those are some of the stories making news. We will return with more stories as Minister of National Security and Member of Parliament for St. James Northwestern toured the Caribbean Military Academy, CMA, in Flanker, St. James earlier today. And the Cannabis Licensing Authority, CLA, asserts that it is unaware of any shortage affecting the locally regulated medical cannabis industry. But first, we'll take a break, and then it's over to Christopher Scott with the latest in sports.